And your son, Leonidas. I'm like, like this kid's gonna get his butt kicked in school. And then named your daughter Riley.
Nate, how's it going?
I like Riley.
Yeah.
Man, you struggle with that phone, don't you? Wow. If you weren't on it all day long, you wouldn't go dead.
Just trying to break that habit and stuff.
Arnie, turn off your video.
Okay. Cool. I'm glad that's drying already.
This month or whatever, because there was shit going on, and I was like, well, I'm not gonna go all the way out there. And so I'm gonna get up in January, but I did, I had some chill time there.
All right, everyone, I'm going to go ahead and get started. See, I can see the Kalispell folks. You guys give me a thumbs up if you can hear me there. Perfect, thank you. It's been a long time since we've had a COVID specific update. I want to let everyone know that we're going to be recording this brief meeting so that in case anyone misses it, you'll be able to go back and get the information or share it with any of your team members who were unable to attend today. Before we get going too far, two quick things I just wanted to acknowledge as we get started. First of all, I know we have quite a few veterans in our company. Today is Veterans Day, so we want to thank all of you who have served our country. We appreciate your service and your sacrifice for the rest of us. So thank you to all you veterans. Second, I think it's today, I think we only have one birthday today. I believe Nancy Schmidt's birthday. So Nancy, if you're listening out there, happy birthday to you. At the end of this meeting, we will have an opportunity for Q&A. I muted everyone, so if you are wanting to ask a question, please be sure to unmute yourself here at the end of the meeting in the event that you have a question. So today's meeting, again, will be brief. It will not take too long for us to cover the information that we want to talk about today, but as many of you are well aware, there has been quite an increase of COVID-19 cases across the state of Montana. In fact, quite a few people in our company have either suspected that they may have COVID or are currently in quarantine for COVID right now. And of course, I am one of them who is quarantined right now, as I had tested positive last week for the virus. I can tell you that for myself, it was definitely an uncomfortable couple of days, Thursday and Friday, there with kind of the severe aches and pains. I know that Jody and Ken also experienced the same. So certainly something we can say that's hit close to home for us. We've had a number of people now throughout our organization who've tested positive now, and some others who are either quarantined or think they may have it right now. So if you do have it, of course, we want to encourage you to be very careful and to be healthy. Make sure you get a lot of fluid and be mindful of the orders that you may have in the specific county that you live in. All of this increase of cases that we're seeing across Montana, and even the ones that are within our own organization, have led us to want to reevaluate some of the policies and practices that we have within our organization as we continue to deal with this virus. The very first thing that we're going to be doing is having a daily temperature screen. So our offices are now all equipped with an infrared thermometer. Every single Dayspring employee is required to have their temperature screen completed each morning, and we will be logging those temperatures. If your temperature exceeds 100.4 degrees, we will be sending you home and isolating you before you have opportunity either come in contact with other coworkers or our customers. So before your temperature screen is completed, make sure that you are first thing in the morning. If you think you may have a temperature, of course, alert us, let us know. But up until the point that your temperature is taken, be sure to be really careful as you come in contact with other coworkers. We are taking this step because this is one of the things that we can do to minimize spread within our own organization and make sure that we don't unnecessarily expose other people in our company or our customers to this virus. So that process will begin tomorrow. There will be a couple of exceptions that may come up where a temperature is not taken. If someone is traveling from one location to another, of course, they may not be able to be screened first thing in the morning, but they will be required when they arrive at the location that they are reporting to duty. They will be required to get their temperature screen taken before they go out into the field. If you have any questions about this, you can contact either Jody in the HR department or the local admin, as they have check sheets for everyone as they'll be logging these temperatures on a daily basis. The next thing that we wanted to just remind everyone of course, you've probably now, as you've seen these posters that we have around our different locations, you probably have started to tune out on these. But we want to again remind everyone how important it is to keep good hygiene practices, to maintain social distance, and use all of the different steps that are important and noted on these posters. And so we just want to give everyone a quick reminder. First of all, make sure that you are washing your hands frequently. Again, you want to make sure that you're not just running them under cold water for a few seconds, but make sure you're using warm soapy water for at least 20 seconds as you wash your hands, and really try to be doing this as often as practical. So, you know, you're probably going to be washing your hands several times per day, probably a couple times in the morning, a couple times in the afternoon. But this really helps us minimize the spread of the virus throughout our company. Second thing is we want to make sure that in each location we are disinfecting at least 2 times a day all of our high-touch surfaces. So our admin and GMs will be working together to make sure that we are staying focused on keeping our surfaces clean and disinfected. We also want to make sure that we are maintaining distance. If you are working in and around coworkers, please be sure to keep that distance between your coworkers. Make sure that you're not, you're really minimizing, I should say, touching or contact as much as possible. And then, of course, as we are having the screen, if you have other symptoms that you are experiencing, please be sure to stay home if you have those. If you have a fever that exceeds 100.4 degrees or other symptoms, please reach out to Jody or the regional manager or your supervisor and let them know there's no reason to come into the local branch and risk infecting your team members. So first question is, when will you be sent home? So we want to make sure that everyone's really clear about this. If you do have either symptoms that are consistent with COVID-19 or that temperature that exceeds 100.4 degrees, we will send you home until you are able to either get tested or until you are not exemplifying symptoms anymore, and there's been the CDC recommended period of time that has passed after the symptoms have been shown. So those are the times that we will send someone home. Now, conversely to this, there are other cases where you will not be sent home. We want to make sure everyone's really clear about this. Cases where you would not be sent home is if you did not have a stay-at-home order from the county that you're living in, or if you do not have the symptoms. So in some cases, we do have situations where someone may have come in contact with someone who may or may not have been infected. Of course, as rampant as this virus is right now, it's pretty hard for people to not be in the same building as someone who may have been either exposed or come in contact with someone who is positive. So we will not be sending someone home unless there is that order or unless there is the symptoms that you have. Now, we know that some people will probably continue to have questions about cases where they may be eligible to receive the pay that is available for COVID. Those cases are specific to the symptoms or in some cases healthcare that's required for family members. But if you do have questions about the pay, please reach out directly to Jody. Jody can answer those questions for you. In some cases, COVID pay applies, and in some cases it does not. And it really depends on the circumstances that go along with those cases. Those are the important things that we wanted to share with you today. One other thing, actually, I'm sorry, that I meant to share earlier when I shared the poster, and that is that we will be requiring anytime we're going to our customers' homes to have at a minimum face masks, so either shield or surgical face masks or other sort of face mask will be required whenever we're going into our customers' homes. We want to be very, very careful that we don't expose any of our customers inadvertently to this disease. So you will see that, again, starting tomorrow, the requirement that we have face masks whenever we're going into our customers' homes. Please be careful, everyone. We want to do what we can to minimize this exposure, minimize the spread of COVID-19. We are hopeful, of course, as the rest of people in our country and our state are, that a virus, some sort of a treatment will be available. We don't, of course, know exactly when that will be. There are some discussions about that by the end of the year as to a vaccine, but we want to certainly do our part to minimize this as much as possible. I think someone may have typed in a question in chat. I'm just going to pull that up here. It says Jody's number is in Bamboo if you have any questions. So again, feel free to reach out to Jody there if you have questions about any of these cases or any of these issues. With that being said, I'll just pause here for a second. If anyone has a question, feel free to ask. Take yourself off mute. I'll just give maybe a minute or two here in case someone has a specific question.
I have a question, Mark. This is Madison.
Hi, Madison.
Hey, so what happens with the temperature screening if we are leaving in the morning and we're not going to the shop, we're just leaving from our house or a meeting spot directly to a job site?
So
how do you want that?
It's an excellent question. So in some cases, primarily in our janitorial team in Helena, we will be taking those temperatures out in the field. For right now, Madison, we're asking that everyone report to the office and not directly to job sites until further notice. So we want everyone to be reporting to the office so that they can have this temperature screen done until further notice. At some point, we may change that. But we want to make sure that that is happening consistently across all 6 locations.
Okay, thank you.
You betcha. Excellent question, though. Thank you for that. Jody, anything else that you can think of that maybe I didn't cover? I can see you there on the screen.
No, nothing for me other than there's just so many variables with this COVID and the different symptoms and the different scenarios for each employee. So again, don't hesitate to call me with any specifics so we can provide as much clarity as possible. And stay healthy.
Yeah, very important to stay healthy. Vitamin C, vitamin D, and zinc are kind of the 3 things that are recommended to boost your immune system. I started taking a battery of those supplements as soon as I started coming down with this. And my experience with COVID was really kind of a uncomfortable 36-hour period, which I know is a lot less than some. So certainly good to be proactive. I know that the emergency, the little kind of vitamin C packs that you can buy down at Costco or whatever, they do have one that has zinc and vitamin D in it. So if you want to get all 3 of those in one beverage, certainly you can do that. I see a question from Tim here. Thoughts on restarting the COVID briefings that were previously taking place? Another great question. We'll look at that kind of on a week-to-week basis. If things start to change, we'll schedule these briefings on an as-needed basis. All right, anybody else? Well, thank you, folks. We sure appreciate your making time to be here at the end of the day on a Wednesday. Thank you for showing up for this. We know that this is inconvenient. We know that having your temperature taken every day can be kind of a pain. As Madison already said, some of us don't plan on necessarily going directly to the shop, but we need to do this temporarily. We want to do everything we can, of course, to protect you and our customers, and we certainly appreciate your help in helping us achieve this goal as an organization. So thank you. Have a great rest of your afternoon, and if you have other questions to think of later, don't hesitate to reach out to either me or Jody.